Welcome to the deep dive. Today, we've got a really fascinating case. It's a medical mystery that I think will have you looking at the human body in a whole new way.
Yeah, it's pretty wild.
This one is going to be good.
It is.
So get this.
Okay.
We're talking about a woman in her 50s who was diagnosed with not one, not two, but three rare conditions all at the same time.
Yeah.
Acromegaly, ANCA-associated vasculitis, we'll call it AAV for short, and Sjögren's syndrome.
Right.
It's like a medical trifecta. You'll never guess how they're all connected.
Yeah, what's really fascinating about this is that this case, which is detailed in a report from Frontiers in Immunology, really makes us rethink the role of growth hormones in our bodies.
Okay.
Could they actually be playing a part in triggering these autoimmune responses? That's what we're going to dive deep into.
Okay, cool. So I think before we get into the nitty-gritty,
Right.
a little explainer on each of these conditions would be helpful, right?
Absolutely.
So start us off with acromegaly.
Okay, so acromegaly is all about growth hormone. Too much of it,
Too much growth hormone.
to be exact. And as you can imagine, this hormone makes things grow.
Right.
So in acromegaly, you see things like enlarged hands and feet, but the excess growth hormone can also affect the internal organs and lead to a whole bunch of other issues like diabetes.
So basically your body's on like a growth spurt gone wrong.
That's a great way to put it.
Okay.
Yeah.
All right, what about AAV? I know it has something to do with the immune system.
Right. So AAV is an autoimmune disease
Okay.
where your immune system, which normally protects you, starts to get a little confused and starts attacking the small blood vessels in your body.
Oh.
This can lead to inflammation and damage in various organs like the kidneys, the lungs, and even the skin.
Doesn't sound good.
No, it's not.
All right, and finally we have Sjögren's syndrome.
Right. Sjögren's is also an autoimmune disease.
Okay.
But this one zeroes in on the glands that produce moisture in your eyes and mouth.
Okay.
So the main symptom is dryness, but there's also a lot of fatigue and joint pain.
Like those achy joints.
Yeah.
Okay, so three different very complex conditions.
Yep.
Now let's meet our patient and kind of trace her journey through this.
Okay.
It all started with some seemingly unrelated symptoms, right?
Right. It started with diabetes and high blood pressure,
Okay.
both notoriously difficult to control in her case.
Really?
Yeah. On top of that, she was experiencing a lot of muscle and joint pain, morning stiffness, and you guessed it,
Dry mouth.
that dryness in her mouth. A classic Sjögren symptom.
Yeah, okay, so that sounds like a lot to deal with already. But it gets even more complicated, right?
It does.
Because on top of all of that, her hands and feet were swelling and she was experiencing constant headaches.
Right.
So I'm guessing these were like clues to something more going on.
Absolutely. These were red flags that couldn't be ignored.
Yeah.
So initial blood tests revealed she had elevated IgG levels,
Okay.
which basically means her immune system was in overdrive, producing way too many antibodies.
Oh.
But more specifically, she tested positive for these antibodies, known as anti-SIRO and anti-SS-BLA.
I see.
Now, these are basically fingerprints for Sjögren syndrome.
Oh.
They're very commonly found in people with the condition.
Ah.
And just to confirm the suspicion, they did a biopsy of her salivary glands, and as expected, it pointed straight to Sjögren's.
So Sjögren's is officially on the board.
Yep.
But we still have those swollen hands and feet, those headaches. Those had to be coming from somewhere, right?
Right, so those are pieces of a different puzzle.
Okay.
You remember acromegaly?
Right.
Well, tests show that her levels of IGF-1, which is a growth factor tied to growth hormone, were through the roof.
Okay.
This pointed suspicion towards the pituitary gland,
Mm.
which is like the control center for growth hormone production. So they did an MRI, and it revealed a tumor on her pituitary,
Oh.
which was the likely culprit behind all this excess growth hormone.
So that explains the acromegaly.
Exactly.
They removed the tumor, and I'm guessing things started looking up, at least on that front?
They did, yeah.
Okay.
After surgery, her IGF-1 levels decreased, although they're still a little bit higher than normal.
Okay.
But the swelling in her hands and feet went down. Her joint pain eased up.
Wow.
Even her diabetes became more manageable,
Oh, wow.
and she was able to come off insulin.
That's amazing. Two conditions seemingly tackled.
Right.
But this wouldn't be much of a medical mystery if it ended there.
Yeah.
What happened next?
So about a year after the acromegaly and Sjögren's diagnoses, she started having problems with her kidneys.
Oh, no.
Her kidney function declined rapidly. She was losing protein in her urine,
Okay.
and blood started appearing in her urine.
Wow.
This was a serious development.
Yeah, so what was going on with her kidneys? Was it related to the other two conditions?
Well, this is where our third condition, AAV, enters the picture.
Okay.
So they tested her for a specific antibody called MPO-ANCA, which is very common in people with AAV.
Okay.
And sure enough, it came back positive.
Oh, wow.
And to confirm the diagnosis, they did a kidney biopsy, and that revealed she had microscopic polyangiitis,
Okay.
which is a type of AAV that affects the small blood vessels in the kidneys.
Hold on, so this AAV was present all along?
It was.
Wow, that's crazy.
Yeah, so they went back and looked at a stored blood sample from her initial diagnosis, and they found traces of those MPO-ANCA antibodies even back then.
Wow.
So this means that the AAV was silently brewing even before her kidney problems became obvious.
So all three conditions were basically overlapping,
Yeah.
each with its own set of symptoms and complications.
Exactly.
It's starting to feel less like a straightforward medical case and more like this complex web of interconnected health issues.
Right.
So the question is, could these three rare conditions occurring together just be a coincidence?
Right.
Or is there something more,
Yeah.
some underlying factor connecting them all?
Exactly. That's the question.
And that's precisely what we're going to explore next. We'll dig deeper into these findings, we'll look for those hidden connections, and try to understand what makes this case so unique.
Right.
So stay tuned, because this medical mystery is about to get even more intriguing.
It is. So before the break, we were just starting to unravel this mystery of all three of these rare conditions occurring together in one patient.
Yeah. It's like finding three rare stamps from different parts of the world,
Right.
all stuck on the same envelope.
Exactly.
The odds are astronomical, right? There has to be some sort of connection.
Exactly. And you remember how we talked about those elevated IgG levels and those telltale Sjögren's antibodies?
Mm-hmm.
Well, it turns out our patient had a whole bunch of other antibodies floating around too.
Really? So even more antibodies? What were they attacking?
It was a mix of different things. To get a clearer picture, they did this specialized test called an autoantibody microarray.
Okay.
Think of it like casting a wide net to see which specific targets her immune system was mistakenly attacking.
Okay.
And what they found was actually pretty alarming. Not only did she have antibodies that were attacking her salivary glands.
Which explains the dryness.
Exactly. But she also had antibodies that were targeting the lining of her blood vessels.
That explains the later kidney problems, right? From the AAV.
Exactly.
So her immune system was basically in a frenzy, like attacking her own body on multiple fronts.
That's a great way to put it. It was widespread immune system dysregulation,
Okay.
which is really a hallmark of these autoimmune disorders.
Yeah.
And to add another layer to this intriguing case, they decided to do some genetic testing.
Oh, the genetics. Okay. This is where it gets really interesting. So what did they find in her DNA?
You know, those questions of why are some people more prone to developing autoimmune diseases than others?
Right.
Well, the genetic testing revealed that she had a mutation in this gene called PTPN22,
Okay.
which is a gene that basically helps keep the immune system in check.
Uh-huh.
And this particular mutation is known to increase a person's risk of developing autoimmune diseases.
So this mutation could explain why she was predisposed to not just one,
Right.
but multiple autoimmune conditions.
Exactly.
It's like having a faulty switch in your immune system's control panel,
That's a great analogy.
making it more likely to go haywire.
Yeah. And do you remember that excess growth hormone from the acromegaly?
Right.
Well, the researchers started to wonder if that could be playing a role in this immune system chaos as well.
Huh. That's interesting. Could the growth hormone be fueling the autoimmune fire?
Exactly. It's not a well-established connection.
All right.
But this case definitely raised some questions.
Yeah.
So to investigate this further, they decided to look back at their records of other acromegaly patients.
So they went beyond just this one unique case
Right.
and looked at a larger group of people with acromegaly, and what did they find?
They looked at the medical histories of 85 acromegaly patients who had been treated at their clinic.
Okay.
And guess what? 12% of them
Wow.
have been diagnosed with at least one immune-related condition.
12%. That's way higher than what you'd expect to see in the general population.
Exactly.
What kind of conditions were they?
It was a mix. Some were truly autoimmune, some were more broadly related to immune dysfunction.
Okay.
So, some patients had things like polyarthritis, which is inflammation of multiple joints. Some had giant cell arteritis, which affects the arteries.
Okay.
There were even cases of ankylosing spondylitis, which is a type of arthritis that affects the spine,
Wow.
and even malt lymphoma, which is a cancer of the lymphatic system.
Wow. So like a whole spectrum of conditions all tied to the immune system in some way.
Right. And 2 of those 85 patients, including the woman that we've been talking about, had Sjögren syndrome.
Yeah, so it seems like more than just a coincidence at this point, right?
Exactly. And while
Yeah.
this retrospective study was small, it definitely suggests a potential link between acromegaly and, an overactive immune system.
Yeah.
It's like the excess growth hormone might be throwing the immune system off balance.
Huh. This is mind-blowing. Like, we often think of acromegaly as just involving, like, the physical changes.
Right.
But could it be impacting the immune system in ways that we're only beginning to understand?
Exactly. And it's prompting researchers to dig a lot deeper and explore this connection between growth hormone and the immune system in more detail.
Yeah.
This could really be a game changer for how we diagnose and treat not just acromegaly, but other autoimmune conditions as well.
It's amazing how one case study can lead to such groundbreaking insights
Yeah.
and potential avenues for future research. But before we get ahead of ourselves,
Right.
let's go back to our patient. How is she treated for AAV, and how is she doing now?
Okay, so for her AAV, they prescribed a combination of glucocorticoids, which are strong anti-inflammatories, to calm down the immune response,
Okay.
and also rituximab, which is a medication that targets B cells, which are a specific type of immune cell.
So a two-pronged approach to tackle those out-of-control antibodies.
Exactly.
And did it work? How did she respond to the treatment?
Well, the good news is that her kidney function started to stabilize.
Okay.
The protein in her urine decreased significantly and eventually went back to normal.
That's great.
Yeah. So it sounds like they were able to get her AAV under control.
That's fantastic. What about the Sjögren's symptoms? Did the treatment help with that as well?
You know what? The dryness that she'd been experiencing, as well as some swollen lymph nodes she had, actually completely resolved after the rituximab.
Really? Wow, so the same medication that helped with her AAV had a positive impact on her Sjögren's.
Exactly.
Rituximab seems like a real game changer for her.
It was. And then remember how her IGF-1 levels were still slightly elevated even after the tumor removal?
Right.
Well, to get those levels down to the normal range, they intensified her growth hormone suppressive treatment
Okay.
using this combination of medications called lanreotide and cabergoline.
So they essentially threw the brakes on her growth hormone production.
Yes, exactly.
And did that work?
It did. After 7 years of follow-up, there was no evidence of the tumor coming back.
Oh, wow.
Her growth hormone levels remained under control, and she continued to do well.
It sounds like despite having these three incredibly rare and complex conditions,
Right.
she received really effective treatment and is living a relatively normal life.
She is. That's encouraging.
It is. But this case is about more than just one patient's journey.
Right.
What's particularly intriguing is what it reveals about this bigger picture of autoimmune diseases and that potential role of growth hormone in their development.
This brings us to the heart of this deep dive. We've uncovered this fascinating connection,
Yeah,
one that could change how we approach autoimmune diseases in the future.
exactly.
But before we explore those implications further, let's take just a moment to reflect on what we've learned so far.
Okay,
We'll be back in just a moment to delve into the broader significance of this really remarkable case.
sounds good.
Okay, so we're back and ready to kind of connect all the dots on this medical mystery.
Yeah, it's pretty amazing.
Right.
Mm.
We've gone from what seemed like a straightforward case of acromegaly to uncovering this potential link to these autoimmune disorders.
It really is remarkable. I mean, this one case has opened up this whole new line of thinking
Yeah.
about the connection between growth hormone and the immune system.
Yeah, exactly. So, for our listener out there who's maybe thinking, why should I care about all of this?
Right.
Let's zoom out a little bit and talk about the bigger picture. Like, what does all of this mean for how we understand and approach autoimmune diseases?
Well, I think one of the biggest takeaways is just the sheer complexity of diagnosing and managing these diseases,
Yeah.
especially when there's more than one involved.
Yeah.
This case really highlights how important it is to be thorough with the testing. Look beyond just the obvious symptoms
Yeah.
and consider the fact that there could be multiple conditions happening at the same time.
It really is a reminder that the body is like this intricate tapestry.
Yeah.
And all these threads are interwoven in
Yeah.
ways that we don't fully grasp.
Yeah.
Right. And this case also raises these really fundamental questions about the root cause of autoimmunity.
Yeah.
Why do some people develop one autoimmune disease
Right.
while others develop several? And what role do things like genetics and environment play in that?
It's like solving a puzzle where each piece is a different factor
Yeah.
contributing to the development of the condition.
And one of those pieces might just be growth hormone.
Yeah.
We saw how that excess growth hormone from the acromegaly could be contributing to immune system dysregulation.
This is where we come to some really potentially groundbreaking avenues for research, right?
Absolutely.
If growth hormone can actually influence the immune system, what does that mean for preventing and treating these autoimmune conditions?
That is the million-dollar question.
Yeah.
Could we potentially use existing growth hormone blockers, which are already used to treat acromegaly, to manage these autoimmune diseases?
Right.
Or could we even go a step further and develop new drugs that specifically target the way that growth hormone interacts with the immune system?
Imagine the possibilities.
Yeah, it could be a real game changer for millions of people.
Yeah.
But I do think it's important to note that we're still pretty early on
Right.
in our understanding of all of this.
Yeah.
We need to do more research to confirm these findings and see what the potential implications might be for new therapy.
Right. It's a reminder that science is like this ongoing journey of discovery.
Totally.
And sometimes these unexpected findings lead to the biggest breakthroughs.
Exactly. I mean, this deep dive has been a perfect example of that.
Right.
We started with a single case study, and we ended up uncovering what could be a paradigm shift in how we think about autoimmune diseases.
So for our listener, the key takeaway here is this. Stay curious.
Yeah.
Stay informed.
Absolutely.
And never underestimate the power of asking questions.
So true.
Medical science is always evolving.
Always.
And who knows what incredible discoveries lie just around the corner?
Right. We've really just scratched the surface of this topic, but hopefully this deep dive has made you a little bit more curious and given you a new way to look at the complexities of the human body and its immune system.
Thanks for joining us on this incredible journey.
Yeah, thanks for listening.
And until next time, keep those questions coming and never stop learning